Antisocial personality disorder, or ASPD, is a term originally coined in the 1980 publication of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, or DSM. ASPD is a blanket term for a unique group of personality defects described as a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. The disorder has also been known as psychopathy or sociopathy, but many researchers believe these disorders are distinct subsets of ASPD. In the DSM, there are 4 criteria that are used to diagnose ASPD. The problem with these diagnostic criteria is that they do not emphasize the most important traits of the disorder: lack of empathy, superficial charm, and grandiose sense of self. However, these characteristics are much more difficult to assess, which may be why the APA decided to sacrifice them from the diagnostic criteria. But this diagnostic procedure, based mainly on behavior, makes ASPD essentially synonymous with criminality, since a high percentage of criminals will meet the criteria for ASPD. Despite this issue, the APA currently maintains that the terms psychopathy and sociopathy are obsolete synonyms for ASPD. But can these terms really be considered synonymous? Evidence shows that while antisocial personality disorder is based on psychopathic characteristics, ASPD and psychopathy are distinct from one another. It is for this reason that many mental health professionals, as well as the general public, still use psychopath as a term to describe some of the most horrifying individuals that exist in society today. The current concept of psychopathy has been thematically linked back to ancient Greece, but it is nearly impossible to know whether this description is that of the current understanding of psychopath. 19th century French psychologist Philippe Pinel used the term manie sans délire, or mania without delirium, to describe patients who engage in deviant behavior but showed no symptoms of any cognitive mental disorder. Robert Cleckley's 1941 publication of The Mask of Sanity marked the first true definition of psychopathy. The title refers to the mask of normalcy that conceals the mental disorder of a psychopathic individual. Cleckley's characteristics have become the basis for the modern description of psychopathy. Dr. Robert Hare, a psychologist specializing in criminal psychology, expanded this criteria in his Psychopathy checklist, the current benchmark for diagnosing psychopaths. It is here that the most obvious differentiation occurs between antisocial personality disorder and psychopathy. While a large percentage of incarcerated criminals, nearly 80%, fit the bill of antisocial personality disorder, only about 20% meet the criteria for being considered psychopathic. However, it must be noted that this small percentage of criminals is responsible for nearly 50% of all violent crimes in the United States. In the Hare Psychopathy checklist, patients are rated on a scale of 0 to 2 in 20 categories: 0 for no, 1 for somewhat, and 2 for definitely. A score of 26 or above qualifies a patient for a diagnosis of psychopathy. The criteria are as follows: glib and superficial charm, grandiose self-worth, need for stimulation or proneness to boredom, pathological lying, conning and manipulativeness, lack of remorse or guilt, shallow affect, callousness and lack of empathy, parasitic lifestyle, poor behavioral controls, promiscuous sexual behavior, early behavior problems, lack of realistic long-term goals, impulsivity, irresponsibility, failure to accept responsibility for own actions, many short-term marital relationships, juvenile delinquency, revocation of condition release, criminal versatility. These diagnostic criteria describe a much different and more terrifying individual than would be imagined from the characteristics of ASPD. The advantage of this checklist is that it establishes a set of diagnostic criteria that are recognized by researchers across the world, just as the periodic table of elements and the Latin names for species have created a universal understanding. The causes of both psychopathy and antisocial personality disorder are still unknown. Recent research has shown that interactions between the amygdala and the prefrontal cortex in the brains of psychopaths are different from those in normal humans. Some psychologists believe that the environment experienced during childhood, especially in cases of abuse or trauma, may cause the disorder. However, a genetic basis for the disorder must also be considered. Psychopaths are unique in their lack of ability to feel emotions. They can understand the world around them, but are not connected to it. The analogy has been drawn to music. Psychopaths can sing the lyrics, but they don't respond to the melody of normal human interactions and emotions. They have no emotions. They kiss or kill without a thought. They are dangerous, without conscience, and all around us. The common public misconception about psychopaths is that they are predominantly either serial killers or criminals, but the majority of psychopaths are neither criminal nor in prison. Instead, it is estimated that 1 out of every 100 people in North America is psychopathic. Psychopaths have been identified in all walks of life, committing a variety of injustices that cause a disproportionate amount of damage compared to other offenders. Psychopaths cause damage in the home and in the workplace that is costly in every respect, and do so without a care. They have a great degree of versatility and can engage in violent crimes, conning and manipulative crimes, sex crimes, and other damaging offenses. The most famous psychopaths, however, are the serial killers, whose destruction has made the word psychopath a cultural landmark that strikes fear into the hearts of many. Serial killers like Ted Bundy and Jeffrey Dahmer have become synonymous with the idea of psychopathy. Ted Bundy was a psychopathic American serial killer active between 1974 and 1978, responsible for the deaths of over 30 women. Many accounts claim that he was an educated and charming young man. He either raped then killed, or killed then raped his victims. Jeffrey Dahmer, whose surname according to Time magazine is now synonymous with monster, was sentenced to nearly 1,000 years in prison after the brutal killings of 17 men and boys. He killed and ate his victims, keeping many of their body parts as souvenirs. So the next question is, can a psychopath be treated? Unfortunately, treatment for psychopathy is far behind the diagnostic procedures that have been developed. So far behind that there is really no effective treatment at all. This is largely due to the fact that many mental health professionals consider psychopathic personality disorders to be untreatable. No interventions or medications have proven effective. Many punishment systems have also proven ineffective because they tend to cause the psychopath to become more cunning and avoidant. Hopes for the discovery of a genetic basis to the disorder involving malfunctions in the brains of psychopaths prove to be the most promising propositions. With neurology and neurosurgery on the rise, this could be the key. In response to criticism about the current criteria for ASPD, the APA researchers developing DSM-IV are planning to revise the classification of antisocial personality disorder to include antisocial psychopathic type, which will have a diagnostic criteria with more emphasis on character than behavior. While the future of treatment for psychopathy and ASPD may be headed towards neurological surgery, the disorder itself will continue to be prevalent in societies of the world.